What is anti-aging medicine?
So the specifics of anti-aging, or the idea of age management, is really to try to prevent osteoporosis, to try to decrease the risk factors of cardiovascular disease, of strokes, to try to decrease the risk factors of dementia, and to actually create a modality within a person's experience where they can continue to feel vital, continue to feel energetic, so that they can continue to live a life that is optimal in terms of its ability to be experienced. There's clear data that substantiates and has been studied systemically and worldwide that basically clearly stipulates and clearly shows and is proven that as the hormones decrease, we develop diseases. So to be able to maintain our optimal health, it is important to recognize what our levels are and to understand what we can do about it. So all you need to be able to evaluate what your hormones are is just a simple blood test. That's all it is. And once you look at the results, you can immediately tell whether you're perimenopause or whether you're postmenopausal. And you can obviously evaluate based on those levels what you're gonna need.
Are bioidentical hormones safe?
Keep in mind that bioidentical hormones, by definition, are hormones that are identical in its makeup and structure to those hormones that your own body produces. So when you're taking a bioidentical hormone, your body actually accepts them as if they were its own.
So instead of pellet therapy, which is very common in bioidentical hormones, you suggest creams and pill form. Why is that?
Well, unfortunately, when you put a pellet into someone, you're committing that person to that particular dosage for at least 3 months, if not longer. And it's a guess, meaning that when I implant a pellet in you, that means that I'm just making an educated guess to what I think you're gonna need. But you're a human being that is very unique and different to everybody else. And so what happens if 2 weeks into it, you're not feeling well? Now you're stuck.
Right, because when you get the pellets, they actually insert it into your bottom,
Yes.
and that's there for 3 to 4 months, and it dissolves over time, but you could spike and go up and then come down. Is that what happens?
That's exactly what happens. So
Okay.
basically, it does not allow me the opportunity to make adjustments that are very unique and specific to the patient. And I can tell you that as much as I have been doing what I do when it comes to bioidentical hormones, I cannot tell by looking at you how much you're gonna need.
Yeah, because I would think it would be a balance, and especially with a cream, you could kind of pull back. This is the cream here. So it's just a couple clicks. You
And
take
that's it.
that and you apply it onto your body. And then if it's too little, too much, you can adjust.
You can adjust it. You can
That's
adjust
great.
it. And of course, we use blood tests as a way to kind of let us know where you are. But more importantly, I listen to you, how you're feeling, how are you sleeping, how's your energy. And the blood tests are a guidance, but my main guidance is the patient. And so ultimately, we're going to be following a balancing act where the blood tests let me know that at least you're taking the minimum amount necessary to prevent diseases of aging. But in terms of feeling better, I also need to give you enough to be able to make sure that we're creating an experience for you that is beneficial.
What age can people do this? Is there an age limit, or can you start doing bioidentical hormones later in life?
Yes, the younger you start in the bioidentical hormone evaluation process, meaning younger, in your mid-40s, when you're beginning to have some deficiencies, the better outcomes you will have, because you will be able to prevent conditions from occurring. But it is never too late. So for example, my own mother is now 76, I believe, years of age, and I started her on bioidentical hormones at the age of 72.
Is this covered by insurance?
Insurance companies do not cover the services that are required to actually balance and improve the livelihood through the bioidentical hormone replacement modality.
And why is that not covered?
Traditionally, the insurance companies tend to cover things that are consistent with the standard of care, and the standard of care at this point has not moved into the pendulum of preventive care. It's still pretty much stuck within the context of sick care. That's one of the main reasons what is not covered. The other one is that when it comes to the therapy of bioidentical hormones, they are not made by an actual pharmaceutical company. So there isn't a big the pocket at the other end that can actually influence our government to begin to move that pendulum in that direction. The average patient in my practice will probably spend about $150 in bioidentical hormone therapy every 3 months. And in terms of my practice, you're looking at less than $800 or $1,000 a year in terms of the actual professional services. So when you look at the totality of things, you know, it's really something that's out of pocket, but you're going to prevent osteoporosis, dementia, cardiovascular disease, strokes, and you're going to continually feel so much better. You're going to have better energy, you're going to have better sleep, you're going to have your tiger back, you're going to be able to feel youthful again, you're going to have the vitality that you need. So when you think about the totality of that investment, if you don't make it, think about what happens when you get to be 70 and you got 6, 7 different medicines where you're now out of pocket is significantly higher, and not only that, but you have less of the vitality that you really wanted to.